Good morning. We are back. The time is 9:14. Next, we're talking about substance misuse or overuse. Research from the U.S. Department of Health and Human Services found in 2022, 48.7 million people aged 12 or older had a substance use disorder in the last year, with alcohol use disorder still the most common form of substance use disorder in America.
It can be hard to know when it's a problem, and it can be hard to know what steps to take to help someone. Dr. Karin Ryan is a licensed psychologist with Nystrom Associates, and she's here to talk a little bit more about this. Hi, Karin.
Yeah, good
How are
morning.
you?
I'm doing well, thank you.
Let's start with just something really simple when we talk about alcohol use disorder. What do we mean by that?
So an alcohol use disorder or a substance use disorder is when you find yourself kind of using more than is healthy for you or more than is like beneficial for you. And so some of the signs, like how do I know if I have a problem, that can be hard. But as you find yourself using more than you used to, you find yourself wanting to cut back or trying to cut back or like, I'm going to stop for a while and not being able to. Maybe you're getting comments from families or friends about it. You notice that it starts impacting your work or your relationships. You find yourself spending more time thinking about it. How am I going to get it? When am I going to get it? Or avoiding other activities so you can use. Also recognizing if there's some withdrawal symptoms, so you feel bad in the morning or you feel bad after you've been using, you find yourself needing to use in the morning to make up for that. So those are some of the big signs. And so even if you have one or two of those, it can be really helpful to kind of just look into that.
Yeah, well, I mean, how do you identify that beyond that list? Like, can you explain the process a little bit more?
Yeah, so if you find yourself wondering, like, I just wonder, or I just even want some support in this because feeling like you can do it alone or feeling like you should be able to do it alone,
I think that's what a lot of
really
people
unfair.
are like, right?
Yeah, they're just gonna like try to knuckle it and just try and figure it out. And what I'm here to tell you is like there is such wonderful support there. So you can call Nystrom, you can call any clinic that does a SUD assessment. SUD stands for Substance Use Disorder, and you do an assessment. And that can sound really scary, but let me tell you, you are just sitting in an office with an LADC, which stands for a licensed alcohol drug counselor, and they're asking you about how you're doing. They're going to ask you about your use, they're going to ask you about patterns, family life, but they are some of the most wonderful people who get it. They're understanding, they're non-judgmental, so they're just going to ask you questions to figure out how are you doing and what's kind of the level of your use and what might be helpful.
So that's once you've maybe admitted to yourself, okay, I'm going to go see someone. But if you're like a family member who's noticing maybe someone's drinking more or substance abuse more and they're in denial, like how does that go? Because that can be really tricky for family members. It can become a rift between families.
Yeah, and it's really expressing concern and care for that person. So if you can come from that place of care and compassion of, I really recognize that when you're using it, we can't be as connected. I would really love for us to have more quality time together, or I can see the negative impact it's having on you. Like, let's get you support. I'm on board. Let's be a team. If you can go in with that person. Some people like, I want to do it by myself. Other people feel it's really helpful that you come along with them. And so you can help with that. And I think the more you can kind of gently highlight the specific behaviors that you're seeing or the negative impact, that can be helpful because it's logic. You know, you can see that logic of those symptoms. And so even sitting down with that person, be like, hey, look at this list here. I'm noticing these 3 things. Can we call together?
So you did the assessment, you've identified that you do have a problem, then what are the options then for trying to address the problem?
Yeah, so after you do the assessment, they're gonna give you a recommendation. So the recommended level of care. Here's what's wonderful, is the client, the patient, has 100% choice. So just because you're recommended that, you get to pick which feels right for you, what you're ready for. So again, I think that's a scary thing. People feel like they're gonna be forced into something. So the first one is an outpatient group. So outpatient therapy where it's 4 hours a week. You come in, it's again run by an LADC. It ties in mental health. There are, like at Nystrom, but groups all around will have morning, afternoon, and evening, so you can still be working. So that's the outpatient group. Then there's intensive outpatient, which is essentially group 3 times a week. So then you have 12 hours of programming, again, the time when you can. It's trauma-informed, it's person-centered, really ties in coping skills. So those are the 2 outpatient. Then there's residential treatment, which is more in when you are there 28 to like 30 days, sometimes it's 60, sometimes it's 90, but you're in there and you are housed there. There's like 30 hours of programming a week. Again, that trauma-informed skills. You can meet with a therapist, you can meet with a psychiatrist, if that would be helpful to you. But again, it's a really welcoming place where there's family programming, you can have visitors. Most of the time they're in beautiful settings where you can get out. And so it can feel so scary, but it's really just a reset and a stabilization.
Are we seeing an increase in this? And you may not even know this answer, but I wonder if we're seeing an increase given that, 2024, there's a lot going on, right? We came off of COVID. If there's an influx, if there's a flux, if it's dipped in the past, like what are we seeing historically speaking?
Pattern-wise, yeah. We saw a big increase in substance use with COVID.
Because people were
and so
home,
people
right?
working from home, and it was easy, and that transition wasn't there. And so that, we really saw an increase in substance use disorder. And then sometimes throughout the year, there's patterns of when people come in and seek treatment to holidays, when life is busy, sometimes they don't, and then when things slow down, you can. So there can be those ebbs and flows. But what's wonderful is a lot of programs, including ours, will get you in within a week. So you meet with somebody within like 3 days, you're going to have a recommendation. Within 2 days, you're going to be kind of starting a program and really invested right away. And so that's really nice too. So when you're ready, we can get you into treatment really fast and get you that support.
When you refer to something called inpatient care, is that where things have reached a certain level of seriousness that it's almost like a hospital stay? Is that
it
what
is?
that,
Yes.
okay.
And so what that one is for like the most acute or the most serious.
Yeah.
And that's really if you're experiencing withdrawals, because that can be really scary when you're trying to stop using and you're having those physical symptoms. So what's nice about being an inpatient is then you've got those medical professionals monitoring you. Again, it's going to be run by licensed and alcohol drug counselors as well. So inpatient tends to be shorter stay, about a week of really getting that like physically stabilized. And then the best type of care is a step-down approach. So you can go from inpatient, then to residential, then to intensive outpatient, and then to group. And it sounds like a lot, but most people find that extremely helpful. Yeah. And what you find is like you love your group members. You build this rapport and this connection, and it can feel really scary to take that first step. But once you're in it, people are like, I wish I would have done this.
Have you ever seen the show Loudermilk?
I have not.
It came out a couple years ago, and it's about group, and it's about group therapy for people who have alcohol issues.
Yeah.
And to me, even watching it was fascinating, and to sort of understand the camaraderie that a group of people build like that.
Yes.
To me, again, not knowing much about it, it just seems so beneficial to be able to be in that kind of a setting.
It absolutely is. That is why we do substance use disorder in groups, because you're not alone. You can tie in and have these similarities. You learn from one another. You gain insight and awareness, and you just have that support, and they have fun. I mean, you'll hear laughter down the hall when they're in group because they're having fun and they're talking about really hard things. Because substance use is a disorder of avoidance, right? We're trying to avoid something, and there's such a combination of that substance use and mental health, and so really coming at it from this comprehensive, whole body approach is really helpful.
Do you guys see kids too? Because I think about this, I feel like we're talking about it as adults, but a lot of times the substance abuse starts with kids.
You're exactly right. That's what the research was, 12 and older. Yeah, so our clinic, our company has adolescent programming. So so we have adolescent groups, and what's neat about our adolescent programming is we pull in the family members as well. So the adolescents come themselves, but then we also tie in the family members to really get that support. And so there's a lot of adolescent programming, as well as there's adolescent, residential, and inpatient as well.
And that assessment process you were talking about, just to reiterate that, is that something that takes a couple hours? Is that something that,
an hour to two.
Yeah. And it's everyone's gentle and non-judgy.
100%. I mean, and the people, they just get it. They get that life is hard, and they get these challenges. And so when you make that appointment and sit down with them, it's an hour to 2 hour conversation about how you're doing, what's going on in your life, and you feel supported after. You're never going to feel judged or criticized. You're going to feel understood, which is so helpful.
Sure.
For sure.
Yeah.
Dr. Ryan, thank you so
good
much.
to see you, Doctor. Have a good weekend.
Our topic to talk about, but an important one indeed.
It is.
Nystrom Associates provides care in the fields of psychiatry, psychology, family therapy, and more.
If you're struggling with addiction, stress, anxiety, or depression, reach out to them. Post more details about their substance abuse treatment options on MinnesotaLive.com.